Hi, my name is Maria Elizabeth Beva, and I'm a research assistant at the Fraser Health Multiple Sclerosis Clinic in beautiful British Columbia, Canada. And today I'll be discussing my study titled Effects of Smoking on Lymphocyte Subpopulations in Patients with MS on Dimethyl Fumarate. These are my disclosures and those of my fellow co-authors. To start with, there have been many studies that have looked at the effects of dimethyl fumarate, DMF, on patients with MS, as this is a common treatment for MS. And what these studies have shown is that some patients will develop lymphopenia over time. And while many studies have linked smoking to MS susceptibility, there have been relatively few studies looking at the effects of smoking during disease course and during treatment. And there have been some studies that have shown that smoking has different effects on different immune cell populations. For example, smokers have increased percentage of macrophages and CD8 positive T cells, but also have decreased amounts of certain subsets of CD4 positive T cells and B cells. And to our knowledge, only one study has examined the effects of smoking on absolute lymphocyte count in patients with MS on DMF. And this study found that non-smoking was actually associated with an increased risk of lymphopenia. And so our objective was to characterize the immune landscape during and after DMF treatment in patients with MS and determine how smoking would affect the immune cell counts. And we hypothesized that there indeed would be a difference between smokers and non-smokers. We looked at blood tests from 289 patients with MS who had taken DMF for at least 1 month in the past 7 years. We qualified smokers as those who smoked regularly or occasionally, and non-smokers as those who have never smoked or who quit prior to treatment initiation. 25 patients were excluded from the study because their smoking status was unknown. What we found is that during treatment, smokers have a greater decrease in white blood cell, neutrophil, lymphocyte, and CD4 T cell count compared to non-smokers, as shown in this table here. Most of the time, there was a twofold difference, and in white blood cell and neutrophil counts, this was a fourfold difference. And we can see that here in these graphs with red representing smokers and blue representing non-smokers, and the dotted line represents the linear regression slope. And although that natural killer cells did not have a statistically significant difference, we can see here that it does appear that smokers have a greater decrease in natural killer cell count compared to non-smokers. When we look at after treatment, we saw no statistically significant differences between smokers and non-smokers in lymphocyte subset recovery. So in conclusion, we found that during treatment, smoking appears to increase the rate of decline in white blood cells, neutrophils, lymphocytes, and CD4 T cells, but there does not appear to be an effect of smoking on immune cell recovery after treatment discontinuation. These results suggest a potential synergistic effect of smoking and DMF on lymphocyte proliferation or circulation. So based on these results, we recommend that patients with MS who are smokers and are prescribed DMF be monitored carefully for decreased levels of lymphocytes because they are at a higher risk of developing lymphopenia. Thank you very much for your time, and I'm happy to answer any questions.